Hi, I'm Dr. Mark Lewinter, licensed acupuncturist at Metro Acupuncture in Atlanta, Georgia.
And I'm Andrea Lewinter. I'm a doctor of acupuncture, also at Metro Acupuncture in Atlanta, Georgia.
Okay. Mom, are you excited about today's topic?
I'm very excited about today's topic. I think it's going to be a really vibrant conversation.
Excellent. One of the things that made me want to become an acupuncturist was that personally, I experienced quick results. So, a couple of things that I experienced from acupuncture that were really positive when I began it at around age 16 was that I had been playing rugby, and it's a very physical sport. It can be prone to injuries, and I walked into the acupuncturist's office limping because of knee pain. And after the first treatment, my knee was significantly better, where I didn't feel like I needed to limp. There still was some tenderness. I felt a little guarded and that I needed to protect the knee, but the pain had significantly decreased.
Mhm.
And another experience I had was not necessarily with acupuncture, but with herbal medicine, where I had a history of some stomach pain. And I knew exactly how long it would last when I had these flare ups. And it would last about 24 hours. And it was suggested that I drink some ginger tea. And I drank this strong ginger tea. And within about 2 hours, the stomach pain was gone. And it hadn't ever been like that before. I became really interested in East Asian medicine and wanted to learn a lot about it because I love getting quick results. Who doesn't love getting quick results? But there are some conditions where one is not going to be able to get quick results. And whether that be chronic pain or someone's been diagnosed with infertility, maybe someone has a history of chronic headaches or migraines. And I wanted to have us talk as acupuncturists, and it might dabble into as son and mother, but how do you encourage your patients to continue their healing journey in spite of conditions that maybe can only be managed, conditions that won't go away, or chronic conditions that could go away, but it's going to take some time? What do you say to those patients?
The place that I normally start is if somebody's coming in with chronic pain and they want to know, is this going to work today? And I like to pull the charge out of that and just start a conversation where every body is different. Even some bodies respond very quickly, some bodies not so much. And just to level the expectation of, is this going to work today? There's a possibility that it will. And for, again, as you said, for certain conditions, it's going to take a little bit longer. I try to take the charge out of that immediate expectation with those kinds of words. I also want people to know that sometimes it takes a series of, and we talk a little bit about a series and what does that look like? Maybe once a week, maybe once or twice a month, but that there may be just that piece that it's going to go on. If it's something, and I also offer that the symptom may change, it may not go away, but the symptom may change. For example, they may need to use less medication if they're taking medications. The pain may come less frequently. It may be less intense. So those are all things on the path of doing acupuncture for any particular ailment. But in particular, what we were talking about is chronic pain. So that we level the field and we both go in looking at what the big picture is rather than, is this going to work today?
Yeah.
Is
Okay.
that helpful?
Yeah, I think that is. And we're just starting the conversation. So you mentioned that everybody's different, and there certainly are people who respond really quickly to acupuncture. There are people who have a moderate response, people who have a slow response, and some people who don't respond at all.
At all.
Not all medicines are going to work for all people. So acupuncture, East Asian medicine is in that category. There are patients that I enjoy treating uh, with chronic pain. I enjoy treating patients who have chronic headaches and migraines. That even those patients, I find that within a few weeks, I'm
Mhm.
able to significantly reduce, or the acupuncture is able to significantly reduce the intensity, the frequency, and duration of their headaches and migraines. What about someone and who has had, we see these patients all the time. How long have you had back pain? Gosh, I don't know. It started maybe about 40 years ago.
Mhm.
And I will sometimes think to myself about a saying in East Asian medicine that for every year that you've had a chronic condition, it may take a season of treatment. If someone has had pain for 10 years, uh, that could be what, 2.5 years of acupuncture? Just doing the math. If they have back pain for 20 years, which is really common, is that going to be 5 years of acupuncture? That's a lot to ask of someone. Ask of someone and say, "Gosh,
I also bring their attention to, or offer this, bringing their attention to what I want you to notice after this treatment will be, how are you sleeping? How are you feeling? How's the nervous system feeling? So that there can be that progression. Yeah, we're working on your back. We're not going to forget that we're working on your back. And part of that is how you're taking care of yourself and what you're beginning to notice in your body. So, just as an example, I'm gonna move from back pain to someone that I see with arthritis in her hands, and she's in pain almost all the time. But what we focused on was, what is she noticing after the treatment? And what she notices that there's less inflammation and there's a greater ease of movement. This is not going to go away. There's been joint damage and so on. So the symptoms are not going to go away. But what she gets from acupuncture is a greater ease of movement and
yes,
less intense pain,
right,
less inflammation. Those are all things that, as a practitioner, we want to bring their attention into, not just a finite, is it there, is it not there, but how are things progressing? Because this didn't happen in a day.
yes,
You mentioned 40 years of back pain. Didn't happen today.
right,
So chances are it's not gonna go away in a day or
yeah,
two.
yeah, yeah." As you were talking, I thought to myself how acupuncture encourages, is the right word, supports the body's own healing process. And
Yes.
there are some things that can't be healed, maybe because of damage. And that's unfortunate, but perhaps we can help the body where we can reduce inflammation and not and things won't get worse. And
Yes.
also, I think, how does the body heal during times of rest? So if someone's not sleeping well and acupuncture can improve their sleep, their pain is probably going to be better.
And there's been a tremendous amount of studies where how lifestyle makes a difference in our pain, in our how often we get disease or colds or so on. So having that patient, encouraging their attention to go to a bigger picture, it's all going to be helpful.
Yes. And also, we're talking about pain, chronic pain, or conditions that uh, don't get better quickly. There can be a mood aspect where one can feel depressed or one can feel angry, sad. Maybe one might isolate themselves because they don't want to be seen with their injury. There can be isolation. And if one's mood, I found that one's mood can often be improved with acupuncture. And one positive thing can lead to another that leads to another that leads to another.
Absolutely. Absolutely. So these incremental steps, and as I said, I think drawing the patient's attention to something, in a sense, a bigger picture. Let's look at your diet. Let's, do the acupuncture, but let's look at how you're sleeping. And little by little, it's like, oh, the knees aren't as hurting as much. So now I can walk down to my mailbox, or now I can walk around the block. And the emotional pieces that you were discussing begin to shift and change a little bit. And that's huge.
Yeah.
It's just huge.
So we're talking about behavioral changes in diet, maybe changes in when one goes to bed, wakes up, also change in attitude or perspective. Acupuncture can support that. And then the conversations that we have with our patients can also support that.
Yes, absolutely. You talk about different expressions that you've heard, and in school, one of the things that was really emphasized is the word is the first needle.
And what does that mean?
The word, what you say to a patient, is the first needle that we place.
Okay, so using that as acupuncturist, needles are our tool for healing, that the words that we use are also tools for healing.
Yes.
Yeah. Okay. And do you have a success story of a chronic condition that it took, whether it be many weeks, many months, a year plus? Do you have a success story where you said there was improvement with a chronic condition, but it took some time?
Yes, I see a patient, and she is, I believe this year she turned 82. And when she came in with a walker and back pain and hip pain and so on, and her doctor told her to get acupuncture, and she would go back to him and say, "Do you think I should still get acupuncture?" And he said, "Yes, continue to get acupuncture." And she went through many iterations of medications and so on, but she kept coming back for acupuncture. And probably maybe a year and a half in, she said, she came in one day and I said, "I'm noticing you're walking much better." She said, "Yeah," she said, "and I started with a trainer, an exercise trainer." I said, "You did?" And she said, "Yes." And she started moving more. She doesn't need a walker anymore. She rarely uses a cane. And she feels better. Her knees don't hurt as much. She's begun to lose some weight. So it really does make a difference. Was it the acupuncture for her back that alleviated the pain? Or was it really her ability to start letting go of her previous beliefs that this was going to be a limiting factor for the remainder of her years?
Yeah, that saying that when the student is ready, the teacher appears. And it's hard to know if one has chronic pain, what is going to be the thing that makes a difference? People will say, "I've tried everything,
Everything.
and you're my last hope." And they're like, "Oh no!" Like every time I've heard someone say, "I've tried everything, and you're my last hope," I think to myself, like, I'm going to be part of you trying everything. It does take a mindset for both the patient and the practitioner to be able to work with chronic conditions. And like I shared with you, my preference is that anyone who comes to see me gets better after the complete relief after the first treatment. And that's a rarity. It can happen. When it happens, it usually an acute condition, and it's usually someone who's younger and they just have a greater capacity to heal.
Mhm.
But most people require a series of treatments. And for some conditions, it requires months of treatment.
Yes. And I think going in with the expectation that let's look at a lot of different things, not just the back pain, not just the knee pain, not just the migraines, but how are we beginning to feel day to day?
So what if a patient was wanting to come in, wanting to try acupuncture for chronic condition. You can pick whichever one. What do you think that they would look for in an acupuncturist, knowing that they're going to work with them long term? One thing that comes to my mind is, do they feel comfortable with this person? Is it at a location that's easy for them to get to? Is scheduling easy? Because knowing that it's a long-term relationship, if each time it requires heroic effort to make an appointment,
Not good.
not good. So what if we were going to talk for a moment, kind of what should a patient look for in an acupuncturist or an acupuncture practice when choosing it- acupuncture care for a chronic condition?
I think the three things that you mentioned are really location, ease of scheduling. No, I'm forgetting the last one.
Communication with the practitioner, relationship.
Communicate. Right.
Yeah.
Relationship with it. And I think that one is the biggest one. Are you presenting yourself as a practitioner, and are they experiencing a level of trust? Can they trust you? And I think for me, that's one of the reasons I start where I do, particularly with chronic patients, is this might work, this might not work. These are the things that we're going to be looking for, and we're going to go forward with this together. So I think relationship is a really big one. Also, if somebody is coming from a long distance, I question that as well, because if it's going to, particularly in Atlanta and the traffic and so on, if it's going to be, as you mentioned, a heroic effort to get there, that's not a good thing. That doesn't set up a good meeting. If it's difficult to get there, is it difficult to get home? By the time they get home, the benefit of the acupuncture, particularly for relaxation, is going to be diminished. So I think all those things are really key. How about you? What do you
The thing is, I've a couple things. I've found that when I feel like I know what someone's outcome is going to be, I have to be very careful because you never know the situations where you think, oh, is an easy fix, should be wrapped up. Just a little tennis elbow after a match a week ago. Really, we're just going to put some needles in and they'll get better within a week. That can sometimes be very humbling when that person doesn't get better after the first treatment. And then there's people who have had chronic conditions and within just a few treatments, they're making, maybe it's not totally cured, but they're making significant improvements. I think that we were talking about travel. There may be someone who we're here in Atlanta, someone who might live in a rural part of Georgia, and there's something that they've seen on our website, watched some of the videos, learned about us, and they're attracted to what we have to offer. And they may only be able to come once a week. I'm sorry, once a month,
once a month? Yeah.
but it's worth it for them because of what they get from the treatment and what they do in between the treatments. We can talk about, yes, location is important. Is it something that someone can afford, knowing that it's going to be ongoing care? Can they afford it financially? Do they have the time make the time in their schedule for it? All these things are important, but never know until we start trying. So I always try to do my best, help that person, set expectations, and we'll see what happens.
Yes.
Another thing I find is that there's a saying, if you maybe aren't feeling great, receive an acupuncture treatment, but also if you're not feeling your best, give an acupuncture treatment. I often notice that by giving treatments, I can feel really good.
Well, I'll say something to that. When we give something to someone else, energetically, we receive a benefit for ourselves because we're connecting with someone on a very deep level when we provide someone with an acupuncture treatment. One of the things that you learn in school is before you walk into the treatment room, develop a mantra, develop a little practice so that you walk in there clean. So my mantra is be mindful. Make sure that my words are clear. Make sure that my heart is open. And before I hit that doorknob, I just repeat that to myself. So when I walk in, I am giving something to somebody.
Yeah. And I think that we benefit by practicing more, and we become better practitioners by practicing more. And the longer we practice, the more patients we're going to see, generally, the more conditions we're going to see. And I find that as I maybe, fortunately, my health is very good and I haven't had to deal with many chronic conditions. But as I have more experience with my own chronic conditions, I can be more sympathetic, understanding, and supportive of other people's chronic conditions. So
Right.
I have the belief that in terms of chronic conditions, you maybe handle some of them, I'm not going to say better, but in a different way than I would, and in a different way than I will 10, 20 years from now, having just more life experience.
I think we probably enter the treatment room in a very similar mindset where we're just going to do our very best. And I guess perhaps because of my age and sensitivity to people that are coming in with these ailments and the gratitude that I am as well as I am allows maybe a little more compassion and not to put sometimes you can push agendas on people and not to push as much is that, hey, you know what? This is what I have to offer. And these would be my suggestions. And be with that patient as they go on their journey because this is a new journey. It's not a medical journey. It's a very new journey.
Yeah.
Yeah,
And appreciating that they know this condition in many ways better than
that's right.
anyone else. We definitely need the help from experts, but I often think that there's ways that I know that I could improve my health. And sounds like what you may do is just support those things that people already know that would benefit them.
Yeah, and I know you experience this. Sometimes you'll say something to somebody and give them a suggestion, and they go, "I know." So we know what to do, but sometimes we forget that, yeah, now let's find a way to work that into your schedule so that you can feel better.
So one of
And
the it's not,
assuring them that they can feel better, that this
yeah,
is a possibility.
yeah, exactly. So that being optimistic, letting them know that they can feel better, also breaking habits
Breaking the habit.
or changing habits. And changing habits is hard.
One of the things that you said earlier is about establishing a bedtime. This is just a little thing, right? It's not a big life changing world evolutionary kind of thing. It's just making a decision. Okay, I'm going to be in bed by 9:30,
Yeah.
be in bed by 10 o'clock. Doesn't matter what the time is, but that you do it and you're congruent. And then just in that small thing, which is not a small thing, but a small thing, is that we start feeling better just there.
Yeah. It's like a savings account but for health. And it's hard to, if one, maybe let's say one is paycheck to paycheck, and say, how can I possibly be saving when I'm just barely getting by? If someone is in maybe has a chronic condition, chronic pain, and they're every day they're fighting this pain or managing this pain, that how could I make space for going to bed or improving? Eating is just the one thing that I enjoy. So I'm going to give that to myself. But even though I know I shouldn't be eating ice cream because it's something that brings me pleasure when I'm having so much pain. But when we make these modifications towards health and wellness, these healthful choices, it can be like adding money into a savings account that can build up over time.
Yes. Yes. And again, it's incremental. This didn't happen in a day or a week or a month, but it's little incremental pieces. And I think sometimes when you break things down like that for people is that it allows them the possibility.
Yeah,
No. That again, it's that mindset, that emotional piece. Oh, this might be possible even for me,
that's right. That's
even
right.
for me.
it's a big topic and one we can come back to. And we're here to help and support acute, chronic conditions. And acupuncture can be subtle, it can be miraculous, and in whatever your experiences with it, we want to be part of it. So if you're in the Atlanta area and you would like to get an acupuncture treatment from us, you can schedule an appointment at metroacupuncture.com. And thanks a lot for watching.
And thank you for watching.